Today, we are diving into a huge misunderstanding in men's health. It's one that affects millions, but it gets misdiagnosed so often that it leads to years of frustration. We're talking about the critical difference between getting an erection and controlling ejaculation, and why getting that diagnosis wrong, well, it can make everything so much worse. Just let that sink in for a moment. This is a real quote from a real patient. Imagine the emotional weight of that. 2 years of wanting that intimacy, all blocked by a medical mystery that just wouldn't get solved. It's a heavy place to start, but it really cuts to the human cost of getting this stuff wrong. And see, this is the question that changes absolutely everything. You know, in medicine, just like in life, our assumptions can be our biggest blind spots. This entire story really hinges on challenging the #1 assumption people make when it comes to men's sexual health. So to really get what's going on here, we're going to follow the journey of one specific couple. Their story is the perfect example of how easily things can go off the rails and, more importantly, how you can get back on the right track. Okay, so meet our patient. He's 31, his wife is 26, they've been married for 2 years, and they have never been able to have intercourse. Now, doctor after doctor told him the same thing. You have erectile dysfunction, and they gave him pills for it. But here's the part that makes no sense. Both he and his wife were totally clear that he could get a full hard erection. So what was really going on? All right, to solve this mystery, we have to get back to basics. The whole confusion is rooted in the difference between two totally separate issues: getting an erection and controlling ejaculation. They are not the same thing. And understanding why is, well, it's everything. Here is the simplest way to think about it. Erectile dysfunction, or ED, is basically a plumbing problem. It's all about blood flow. Premature ejaculation, or PE, on the other hand, that's a wiring problem. It's about your nerves and the reflex control in your brain. One is about hardness, the other is all about timing. So let's be crystal clear about ED. It's a mechanical issue, a blood flow issue. The brain is sending all the right signals, but for whatever reason, usually related to blood vessels, not enough blood is getting in and staying there to make the penis firm enough for sex. It is purely about achieving and holding on to that hardness. Now, on the flip side, we have premature ejaculation. With PE, the erection is there. Hardness is not the problem. The problem is that the go signal for ejaculation just fires way too early, sometimes with barely any stimulation at all. It's a timing and control issue, not a hardware issue. And this brings us to a really major shift in thinking. What if PE isn't a disease in the way we usually think about it? What if it's something the body has simply learned to do? Reframing it like this is the absolute key to finding a real solution. The specialist in the case we're looking at, Dr. Gupta, he calls it a trained reflex. And wow, that is a total game changer. It takes the problem out of the category of some permanent defect and puts it into the category of a learned behavior. And you know what's great about learned behaviors? They can be unlearned. These analogies are just perfect. A swimmer who has bad form isn't diseased, right? They just need to retrain their muscles and their technique. A driver who keeps stalling the car isn't broken. They just need to retrain their coordination. It's the exact same principle. The brain-body connection has simply learned a super inefficient rapid release pattern. So how does this habit even get built? Well, it's usually a mix of things. It could be a history of, rushing things. It could be performance anxiety that creates this constant sense of urgency. Maybe it's high nerve sensitivity or even weak pelvic floor muscles that just don't have that holding power. You put them all together and they can train the body for a quick finish. Okay, let's circle back to our patient, the one who was stuck for 2 years. Now that we understand this whole plumbing versus wiring thing, we can see exactly why the standard treatment he was getting was just destined to fail. So he was being prescribed medications like tadalafil, which are great if your problem is actually blood flow. These drugs are designed to help the plumbing. They're all about improving hardness. It's kind of like trying to fix a car's faulty brakes by putting more gas in the tank. It makes no sense. It doesn't address the root cause at all. You just can't fix a wiring problem by boosting the plumbing. And this is the real kicker. Not only does it not help, it can actually make things worse. Think about it. You're increasing arousal and hardness, but you're not giving the person any new tools to manage that excitement. So what happens? The reflex can actually become even faster. This is exactly why our patient felt like he was going backwards. So if those pills were the wrong move, what's the right one? Well, the real solution isn't some magic pill.
It's a full-on strategy that's designed to retrain that learned reflex. It's all about regaining control. The real plan, it starts with the right diagnosis, testing the wiring, not just the plumbing. Then, it's about actively retraining your body, often using biofeedback, to create a new, slower habit. You support that with physical strengthening, with exercises like Kegels. And sometimes, you might use temporary medical aids like special sprays to help the body learn that new, slower pattern. And get this, we're not talking about a lifelong battle here. With the right diagnosis and a plan that you actually stick to, even severe cases of PE can often be turned around in just 3 to 5 months. I mean, for someone who's struggled for years, that is a message of incredible hope. So when all is said and done, what's the one thing you absolutely have to take away from this entire story? It all boils down to one simple but absolutely crucial distinction. That's it. You cannot solve a timing problem with a hardness solution. Just understanding that one sentence is the key that unlocks the correct diagnosis, the right treatment, and ultimately the way out of years of frustration. And that leaves us with this final question for you to think about. It's a prompt to challenge assumptions, to ask better questions, and to make sure that the problem being treated is the problem that actually exists, because getting the right diagnosis, that changes everything.